or home care are kind of interchangeable with home health. And so in the industry, sometimes it's not always clear to people what the different services are. So let me just break it down just a little bit. There's a medical side to home care, often referred to as home health, and that's where they're providing nursing and physical, occupational, and speech therapy services, and medical social worker, and sometimes an aide. Those are typically temporary services. They're not, ongoing for long periods of time. Usually something's happened, whether there's, a fall or an illness, a hospitalization or a surgery, that sort of thing. They're going to a rehab and then they're going home and they're getting medical services. There's lots of treatments and IVs and wound care, lots of different things that are happening in the home that are all kind of medical in nature. So then you have the kind of more on the home care side of it. Now this is interchangeable again, but that's oftentimes a home health aide or a home care aide. It's just someone who's non-medical for the most part, and they're going into the home to provide support to that individual, whether that's light housekeeping and meal prep. Sometimes they'll help with personal care, with just being there for if they're bathing or dressing. And there's lots of things that fall into that grouping, and sometimes it's covered by private pay, or it's covered by Medicaid. There's a lot of Medicaid services out there that kind of fall into the home care side of it. And also in the Medicaid world, there's also what's called there's like a pediatric branch of it. And so what they do is they provide actually a nurse that's going in and staying with a special needs child, and typically that's going to last. That's an ongoing, and that can be just through the day or through the night. Sometimes it's 24 hours, that sort of thing. So home care has this whole host of different services that they provide, and so sometimes it's difficult to know what services are right for you, and that's why we often encourage people to call our number, and they can find out if they qualify for Medicaid, for instance, or their child qualifies for these special services, or if they qualify for home health services. Also under the umbrella of home care is probably hospice. This is something that's actually provided in the home as well. And most people don't know if they qualify for hospice or not. There's a particular, there's a grouping of diseases that kind of fit the hospice diagnosis. I think most people come on to hospice services way too late. They don't realize that they might qualify for services earlier, and hospice services cover typically the pharmacy, the DME, a nurse, social worker, a spiritual counselor or chaplain, a bath aide, and there's just a whole host of things that are covered under these services that people, and usually it's like a 6-month window. So if someone they believe could potentially be in the last 6 months of their life, they can qualify for hospice services. And I'll get into in a